Morning, everyone. It's Nigel Giam here. Welcome back to Mentor RCA interviews with ST3s who've recently passed the RCA. I'm so happy today to have Neha on, who came to see me, I think, at the beginning of the year, and actually smashed the RCA recently with an amazing score of 186. Welcome, Neha. Congratulations. How are you doing?
Oh, hi, Nigel. Thank you so much for having me. And I feel really honoured to be able to be on here at last and to be like, yes, I passed.
At all. Yes. And actually, you had quite an interesting narrative because you were all prepping up for the CSA. And then obviously pandemic. And then we had a bit of time out of practice. Do tell us a little bit about your narrative back into the RCA and the challenges you faced.
So I'd already been out for 2 years because I transferred deaneries and I had a little one as well. So I'd had a year of maternity leave and out of program. So when I had left, I was preparing for the CSA, having passed the AKT in my first pregnancy. And so when I came back, it was like time to prepare for this new exam, new concept, no idea what I was doing. And, 2 years out of practice, I was really just not, I didn't feel like I was geared up for this exam at all when I first started.
Yeah, so there was that time out of practice, and then when you came to see me, you were then also expecting, weren't you? And I've got a number of kind of pregnant trainees or trainees who are coming back from mat leave. So you had quite a short space of time to kind of get your cases together. And this was the first time you ever sat the exam and you smashed it. How did you go about thinking about your case selection? What sort of top tips would you be giving our trainees out there?
So I think when I first started, I got the advice that just record yourself. And I don't know if that was the right advice because I felt like I was burnt out. I was recording anything and everything and I didn't know what I was doing. And I was just fed up. I was like, this exam is awful. I don't understand it at all. So I went on the RCA on the website, the ARCGP website, and I just looked, I was like, what is the mandatory criteria? What do I need to do? And what sort of cases do I need? And I started making a list of the sort of cases I was looking for, which would have, and I looked at the challenge list, the low challenge, moderate challenge, and high challenge. And I knew I needed something in the middle. So I started making a list of possible cases, but I kept my list quite broad so that I wouldn't, have my selection so narrow and I wouldn't be very, very picky. And then from that, I started prepping crib sheets for those cases. And that's when I started to realize this is what I needed. So when, I was in the practice, I knew what sort of cases I was looking for.
Excellent. So basically you did a lot of case priming, prioritizing your mandatory cases, looking at the challenge of the case. We talked a lot about the angle of a case as well, didn't we? Yes. On the course, specifically thinking what are the complicating factors of the case to try and bring that challenge up a little bit higher. You obviously were so close in terms of having, your baby and the RCA submission. When it came down to the crunch and you were actually looking at your case selection and choosing what you felt were the best ones, what do you think you were trying to showcase with your cases in particular?
So I think what I'd done is, your course had really helped me with this, which was I split up the mandatory criteria into data gathering, interpersonal skills and clinical management. And from that, I thought, okay, I really need to showcase my skills as a doctor. Yes. I need to see what shows that I'm a doctor and not another sort of clinician. Yes. And I think that's what was the key. Is like when I'm doing the data gathering, what differentiates you from a nurse or from a PA or a pharmacist when you're data gathering? What are your flags? Do you know what you're talking about? So when I was doing my data gathering, obviously I'd prep myself, so I was getting my data gathering done in the 5-6 minutes of the course is what had helped me with that a lot. But it was when I was doing that, I was listening to my data gathering. Okay, have I covered all the key points? Okay, yes, I missed this question, that question, but is it really that important? No, it's not the make or break question, like a significant red flag.
And that's so important, isn't it? Because I think if we start thinking about perhaps some of our colleagues who are allied healthcare professionals and maybe following more of a sort of a template, it becomes quite formulaic then, doesn't it? Whereas actually in the RCA, you may not have asked a specific question, but it's not going to change what you do. It doesn't change the management. It doesn't change where you go. And it's quite interesting you mentioned, obviously, talking about the questions that we would ask as doctors, but actually the questions that we would also ask as GPs compared to, I suppose, our secondary care colleagues. So just, I suppose, wrapping up, lots of trainees who might find themselves in a similar position to you, what kind of words of support can you give them to keep up the energy and show them this is attainable?
Oh, Nigel, I think you just said the key word, which was energy. That's the one thing that I really, really found I struggled with. And it was your course that gave me that, that energy that I needed. I think you need to take all the support that you can get. It's just for a couple of weeks and you just give it your best and you can definitely do this. Okay, we can all do it. And like, just with the right tools, we just need to prepare ourselves, just give some time to it and it'll be worth it, because sometimes it feels like the end is not there. Sometimes I felt like with my little one, I'd never see him. I was like, what am I doing? I'm neglecting. But I knew it was just for a short few weeks, and you can do this if you give it the energy that you need and that it needs. You'll get it. You will.
Oh, I'm so happy for you. So now, what is the plan? Because you've got little ones. You're going to get your CCT soon. What's happening? What's on the horizon for you?
Oh, I don't know. There's so much out there. I think I definitely want to do something to do with Gypsy. So I've got like a couple of things that I'm interested in. I've got a couple of courses I can finally do. Might go to university again and get another diploma.
More work, more assessments.
I don't like to stop. So I'm looking forward to doing that instead of exams.
Lovely. Well, it's been fantastic to see you. I'm sure we'll keep in touch. Thank you so much for your time this morning, and all the best moving forwards. Thank you so much, Neha.
No, thank you, Nigel. Thank you for everything, and thank you for your tips as well. I really think it made a difference.
Pleasure. Take care.
Thank you.
So many thanks to Neha for sharing her narrative and really giving hope that actually this can absolutely be done, especially during very challenging personal circumstances. We talked a lot about case selection in this particular interview, and it's so important that you recognize that your case has to show not just adequate challenge but also additional complicating factors to really showcase the best of yourself, to really optimize the marks that you're going to get. If you choose a low challenge case, if there are no complicating factors, then you won't score more than really 2 or 3 marks out of 9, and the magic number really is 6 out of 9. Neha talked about specifically the domains, data gathering, clinical management, interpersonal skills, and actually what we do teach on the course is how to objectively mark your own RCAs. You can download my mark sheet from the resources section of the website mentormededucation.com. Feel free to join the Facebook support group. I hope you found this one useful, and I look forward to interviewing more ST3s to help you guys. Keep that energy up. Please don't lose hope. There are so many things that can be done to make sure that you attain and optimize a good RCA pass. All right, take care. Have a great day. Bye now.